And is that because there is no funding for this kind of research, and is that
Mhm.
stopping because for something like a COVID, you could actually produce a vaccine so fast, while here for 50 years you are actually saying all these were discovered in 1950s, yet you don't have research and funding backing for something like this.
Well, yes, people care more about COVID than they care about mental health. If we put the same effort into mental health as we did into COVID, we would definitely improve things a lot. There's no question, but we don't. And I'm actually writing that. You heard me give that talk. Now I'm actually writing a paper, hopefully for Lancet Psychiatry. It's called 50 Years of Failure. And I go through like the 17 reasons why we got this, and I hope, but there are solutions, and the solution is take it seriously. And here's an interesting example: is antibiotics. 20 years ago, companies stopped making antibiotics because the regulators said, "Well, you've got to be better than the current ones," and they said, "Well, that's impossible." And they said, "Well, we don't want the new ones." Sadly, we did need new ones because we need ones that were different. So when one fails, when a bug gets resistant to one, we need a different mechanism. But the regulators said you've got to be better. So the companies just said can't. And now, actually, literally today, the British government has just announced a new fund to help improve the innovation in antibiotics. We should be doing exactly the same for mental health problems because they're not going away, they're growing, and our treatments, as I say, we've got no innovation in depression, anxiety, and schizophrenia. We've improved drugs. We've got less toxic drugs, got safer drugs, got longer acting drugs, but we haven't got new drugs.